The new Health Service Research Centre has a theme to do with organising care, the way in which we organise health and social care. And one of the research projects we're undertaking on that, with support from the Health Foundation, is on Greater Manchester's health and social care devolution experiment, which is being watched with huge interest right across the country.
We research the process of getting things into practice. So it's not just about, here's something that's been shown to work, let's put it in practice. We actually say, how do we put it into practice? What can we learn from that? How can we generate new knowledge?
It actually brings together health service researchers who've been doing health research over a really long period. And the idea is that we get a kind of shop window for those outside of MBS to make it much easier to find those people.
We're doing work funded by the National Institute of Health Research, trying to understand the impact of inspection and ratings on the performance of health and social care organisations. And that's a really important question. It's one where we know that there are issues to do with huge variation in the quality of care and the quality of and performance, where again we're bringing our research to bear on something that matters a lot to the health service.
We are focusing as a group of researchers upon looking at what happens to management skills, management knowledge and management practice. So we're drilling down, if you like, from the more macro organisational changes that are affecting healthcare organisations into what's happening to managers at the level of their practice and also their professional identity as managers.
Most of the work in the theme is funded through a thing called the CLARC, which is CLAHRC. It stands for Collaboration for Leadership in Applied Health Research and Care, and it's a big 5-year programme funded by the NHS National Institute of Health Research and a lot of matched funding partners, as they're called, from the NHS in Greater Manchester, both hospitals, general practice, and from third sector organisations, the Stroke Association, and some small industry funding as well.
Clearly there's been an awful lot of changes within healthcare affecting management and the numbers employed and engaged within management structures, and part of what we look at has been investigating the consequences for management, including increased workloads, restructuring and the implications that has for management jobs and roles and responsibilities, and the stresses and strains placed upon managers within a healthcare environment.
We've always had a big body of health services research going on within the business school, and a lot of collaboration between this school and other parts of the Faculty of Humanities, and particularly with the Faculty of Medical and Human Sciences, with lots of research across the university on health systems and health services.
We know a lot about what to do, but we need to learn more about how to get that into practice. So the focus of the implementation theme is about working to get things into practice, particularly clinical things that have been developed, but to study that process and to learn much more from that.